Hi, I'm Susan Sabo. I'm here to introduce you to the health coach who is presenting this video to you. His name is Steve Sabo. He has a Bachelor of Science degree and a Master of Science degree in cell biology. He has a thorough understanding of physiology, biochemistry, and nutrition, and he's been a health coach to hundreds of people for over 15 years.
Here's a great fact backed by science. 70% of older adults who adopt just one extra daily health habit experience significant improvements in their health in just 1 month. That means that your daily habits could be the key to giving you better health. In this video, I will explain the three-level health pyramid for seniors, which reveals simple ways that you can improve your health over the age of 50. The health pyramid I am presenting here is a modern, holistic adaptation of the health pyramid for seniors, and it organizes senior wellness into three broad, interdependent tiers. Imagine waking up every day feeling full of energy and ready to handle anything that life presents to you. You can have that with the right daily habits, and this pyramid is a great place to start. After I introduce you to this health pyramid, I'll dive into each part of it in detail. Please consider liking this video and subscribing to my channel. I appreciate your support. The three-level health pyramid for seniors is a great way to view and assess your overall health. Let's take a look at it now. Here is the whole pyramid. I'm going to look at each level and each part individually. This health pyramid is a model that includes all of the elements necessary for maintaining overall health and well-being in older adults. By prioritizing habits you develop from the pyramid, you can improve your overall health, quality of life, and length of life. You'll notice that the pyramid has three levels and each level builds on the one below it. At the top level is your goal: feeling better, functioning better, and living longer. This is the why behind the actions in the pyramid, and it creates the motivation for doing everything else. But it all starts with the bottom level, so let's look at that in detail first. The bottom level is the health triad. This level recognizes that long-term health is a balance of three interrelated domains: nutritional health, physical health, psychological health, which is the same thing as mental or emotional health. Let's look at number one, nutritional health. This includes an adequate and balanced diet tailored to aging physiology. And why does this matter? Nutrient needs shift with age. Older people need more calcium, vitamin D, fiber, and protein, for example. These are all essential, and calorie needs often decrease. Nutritional health includes hydration, fiber-rich foods, low sodium, nutrient-dense meals, and supplements if necessary, for example, B12 and vitamin D. Now we will look at number two, physical health. It includes mobility, strength, cardiovascular health, chronic disease management, sensory function, vision and hearing, and fall prevention. So why does this matter? As people age, maintaining physical health helps with independence, reduces the risk of injury, and improves overall quality of life. The key components are physical exercise, medication management, and routine medical checkups. Now we'll look at number three, psychological health, which is also mental or emotional health. It includes cognitive function, emotional resilience, social connection, and purpose. And why does this matter? Seniors are at increased risk for loneliness, depression, and dementia. To ensure that those don't happen, practice these things: regular social interaction, mental stimulation, therapy when needed, spiritual engagement, and mindfulness practices. To summarize, these three elements of the health triad level form a stable base. If one pillar weakens, for example, poor nutrition, it destabilizes the rest. In this example, the result would likely be increased depression or reduced physical strength.
Now, let's look at the middle level, daily activity. These are the everyday habits that support long-term health. This level consists of 5 key aspects that contribute to successful aging. 1. Nutrition. 2. Physical activity. 3. Sleep. 4. Preventive care. And 5. Mental health. Let's look at the first one now. Number 1. Nutrition. Here are important considerations. Eat balanced meals regularly. Include plenty of whole foods, protein, and hydration. Monitor sodium, sugar, and unhealthy fats. When looking at nutrition, a balanced diet is a critical component of good health. Your diet should include plenty of fruits, vegetables, whole grains, lean protein sources, and low-fat dairy. Focus on nutrient-dense foods. Prioritize foods packed with vitamins and minerals because older adults usually have increased nutrient needs. Have adequate protein intake. Ensure sufficient protein consumption to help maintain muscle mass, which tends to decline with age. Hydration. Drink plenty of fluids, especially water, to prevent dehydration, which can be a significant concern for seniors. Now let's look at the second aspect of this level, physical activity. Regular physical activity is crucial for maintaining physical function, mobility, and overall health. Here are some good guidelines for physical activity. Perform a minimum of 150 minutes per week of moderate activity. Incorporate strength, balance, and flexibility exercises. Adapt to limitations. Depending on your situation, consider walking, water aerobics, and chair yoga, for example. Primary considerations are aerobic exercise. Engage in activities like the following to improve cardiovascular health: walking, swimming, and cycling. Strength training. Incorporate exercises that build muscle strength to maintain independence and prevent falls. Balance exercises. Practice activities like Tai Chi or yoga to improve balance and reduce the risk of falls. Now let's look at the third aspect of the second level, sleep. Getting adequate sleep plays a crucial role in maintaining both physical and mental health. Lack of sleep can lead to stress, memory decline, increased risk of conditions such as obesity, diabetes, and heart disease. Quality sleep helps the body recover quickly and also improves memory, concentration, and emotional stability. When well rested, the immune system functions more effectively, helping the body fight off illnesses. By establishing healthy sleep habits, older adults can significantly improve their sleep and overall well being. Here are some simple tips to ensure you get quality sleep. Reduce light exposure in the evening. Avoid electronic devices before bedtime. Avoid stimulants late in the day. Keep the bedroom temperature around 19 degrees Celsius or 67 degrees Fahrenheit. Here are more tips to ensure you get quality sleep. Use blackout curtains to minimize light from the outside. Aim for 7 to 9 hours of sleep. Establish a regular sleep schedule. Deal with insomnia, sleep apnea, or restless leg syndrome. Now, let's look at the fourth aspect of the second level, preventive care. Staying on top of health screenings and preventive care can help detect and manage potential health issues early. Here are some important considerations of preventive care. Regular medical checkups. Schedule regular appointments with a healthcare provider for routine checkups. Get routine screenings for blood pressure, cholesterol, cancer, and vision and hearing. Stay up to date on recommended vaccinations to prevent infections. Review your medications frequently to reduce polypharmacy risk. Polypharmacy is taking 5 or more medications. And with that comes the risk of adverse drug effects, medication errors, and drug interactions. Now we will look at the fifth aspect of the second level, mental health. Maintaining cognitive function and emotional well-being is vital for a good quality of life. Here are some important guidelines. Cognitive stimulation. Engage in activities that challenge the brain, such as reading, puzzles, learning new skills. Social interaction. Maintain social connections and engage in social activities to prevent social isolation and loneliness. Research shows that loneliness can increase the risk of depression, memory decline, and a weakened immune system. Social connections have a profound impact on the mental and physical health of older adults. Maintaining positive social relationships can extend life expectancy by up to 50%. Seniors should engage in at least one meaningful conversation each day, whether by joining a book club, participating in a community exercise class, or volunteering. Stress management. Practice relaxation techniques to manage stress effectively. Here are great techniques: meditation, deep breathing. To summarize this level, these are daily maintenance practices or healthy habits that reinforce and optimize the stability of the bottom level. Now let's look at the top level, the goal, the outcome of a healthy life foundation and consistent habits. This level represents the purpose and payoff of the pyramid. What does feel better mean? With reduced pain, more energy, clearer thinking, you will feel a lot better. This will lead to a better mood, confidence, and motivation. And what about function better? This really means having the ability to perform activities of daily living independently. It also means improved balance, mobility, strength, and endurance. And ultimately, it means less reliance on caregivers or assistive devices. And finally, what are the implications of live longer? The goal here is an increased lifespan with a greater health span, the number of years lived in good health. This also means there is a lower risk of chronic disease and disability. And with all of this, you'll have more time for family, travel, hobbies, and community involvement. To summarize, the top level is the motivational level. It encourages seniors to embrace healthy behaviors, not just for survival, but for thriving. Now we'll look at how the levels of the three-level pyramid work together. This pyramid differs from traditional food-focused pyramids by integrating all aspects of senior wellness and showing their interconnectivity. The health triad, physical, nutritional, psychological, is the base and must be nurtured. The daily activities has the actions seniors take to strengthen and maintain the triad. And the goal level gives direction and meaning to the daily practices, encouraging motivation and consistency. This model can be a valuable tool because it promotes whole person care, encourages proactive prevention rather than reactive treatment, acknowledges the importance of mental and emotional health alongside physical health. Putting your plan into action. Now it's time to put your plan into action. Start with these simple steps. Choose one habit from each level of the health pyramid. Set a fixed bedtime to improve sleep quality. Take a 15-minute walk after lunch to stay active. Solve a crossword puzzle daily to keep your mind sharp. Spend 5 minutes each morning practicing deep breathing to reduce stress. These habits all work together. Better sleep gives you energy to exercise. Exercise helps you focus on brain boosting activities, and all of them contribute to better overall health. Are you ready to get started? Make your health pyramid a reality. Your journey to feeling better begins today. Choose your first new habit and stick with it for a week. Then add another, and so on. Soon you'll start noticing real changes. Thank you for watching. Please remember to like this video and subscribe to my channel. And remember, the best of your golden years is ahead of you. And please check out another video in my channel called Habits to Stay Healthy After 50. It has a lot more great tips and insights for staying healthy after age 50.
Steve has a free gift for you. It's a free PDF document called 6 Tips for Nimbleness. Steve is offering it to you here. Just scan the QR code on the screen or go to the link that's there to get his free download 6 Tips for Nimbleness.
See you in the next video.